In this video, we talk about how do you get diabetes? At the end of this video, don't forget to click the link in the description to see a proven program to help you better fight diabetes. There are two main types of diabetes mellitus. These are known as type 1 and type 2. Type 1 diabetes mellitus used to be called insulin-dependent diabetes mellitus, or juvenile-onset diabetes mellitus because it usually begins in childhood or adolescence. In type 1 diabetes mellitus, the pancreas releases no insulin at all because the body has destroyed the cells that produce it, islet cells. The patient, therefore, relies on treatment with insulin. Type 2 diabetes mellitus is the most common form of diabetes. It used to be called non-insulin dependent diabetes mellitus, or adolescence diabetes because it usually begins in adulthood. In type 2 diabetes, patients can still produce insulin but they do not produce enough, and/or their bodies cannot use it properly. Treating high blood pressure and controlling the levels of fats, lipids, in the blood is also very important in patients with diabetes as they are at greater risk than the normal population of developing serious cardiovascular diseases. A group of medicines known as ACE, angiotensin-converting enzyme, inhibitors is sometimes used to reduce the risk of developing cardiovascular complications in diabetes and can also reduce the risk or progression of kidney and eye diseases. What causes diabetes? While scientists aren't exactly sure why type 1 diabetes happens, they do know the immune system is involved. A healthy immune system protects us from diseases caused by infections, such as colds or the flu, as well as diseases that start in our cells, such as cancer. For some reason, in certain people, the immune system becomes confused and begins attacking and destroying the cells in the pancreas that make insulin. 4 Scientists aren't exactly sure why type 2 diabetes happens either, however, they have identified that it occurs most often in certain individuals. About 80% of people with type 2 diabetes are overweight, have high blood pressure, and have high cholesterol levels in their blood. Could the diabetic formula lower my blood sugar level too much? In general, too low blood sugar levels should not be a problem. A high-quality diabetic formula containing synergistic vitamins, minerals, and herbs most often lowers blood sugars to normal levels. However, these vitamins, minerals, and herbs will not excessively lower blood sugar levels that are already normal. Thank you for watching and don't forget to subscribe and like my videos.